Here's a question you haven't thought about yet today. Should military members be using more weight loss medication to slim down and stay fighting force ready? Various branches for years have battled too fat to fight assessments that say too many troops are not physically fit enough to perform combat duties, and responded with various PT requirements and other regulations. But what if you could just take a pill? With Ozempic and other drugs exploding in popularity, a new study suggests weight loss treatments have been underutilized among military members. Should that trend change? And what would be the impact? Reporter Jonathan Lehrfeld is here with more.
The United States military wants its troops in tip-top shape. At a moment's notice, warfighters must be ready to protect American people, assets, and interests at home and abroad. And to do that, members of the armed forces are required to meet specific standards set by their respective services. But for many reasons, service members may struggle to achieve expectations about their weight. In response, the military has set up numerous pathways for its troops to shed the extra pounds, from fitness training to nutrition education. But not everyone can easily lower the intimidating number on the scale, even with regular dieting and exercise. The increasing prevalence of weight disease in the US, both in and out of the military community, has led to the employment of alternative solutions to manage the epidemic. That includes one that often garners a mixture of positive and dismissive reactions: anti-obesity medications. TRICARE, the military's healthcare program, began approving coverage of weight loss medications in May 2018, following authorization from the 2017 National Defense Authorization Act. A spokesperson for the Defense Health Agency told Military Times these are doctor-prescribed medications and are not issued directly to troops. Service members see a TRICARE authorized provider who prescribes the medication based on medical necessity. While usage of anti-obesity medications has grown in the military since their authorization, overall it remains low. Now, researchers say that compared to the civilian world, the military health system is significantly underutilizing the drugs. They say they're a tool that could aid in patients' health, improve military readiness, and reduce fiscal costs associated with being overweight or obese. According to a study published in August, funded by the Pentagon's Defense Health Agency, less than 1% of active duty personnel use anti-obesity medication. But the authors of that report noted they could reasonably extrapolate that at least 22% of the active duty population would qualify for the use of medications because they meet BMI criteria for having obesity. So why is the military not utilizing the medications to a higher degree? Here's an important point. The services are not handing out weight loss medications willy-nilly. There's a systematic, comprehensive procedure medical providers follow that involves getting a prior authorization. TRICARE utilizes a protocol that requires one of the anti-obesity medications, phentermine, be used before others can be prescribed for patients. The course of treatment depends on the drug prescribed and the physician's instructions for its use. Another reason the military may not be utilizing the medications more: supply. While some companies have announced in recent months they are lowering the cost of weight loss drugs for patients, offering them as single-dose vials, as of August, the FDA lists limited availability for other anti-obesity medications as a result of increased demand. A strong desire among Americans to use the meds tracks, given the high prevalence of being overweight or obese across the country. According to the Centers for Disease Control and Prevention, in 2022, all U.S. states and territories had an obesity prevalence of more than 1 in 5 adults, with the Midwest and South having the highest prevalence of obesity. All of that has an impact on recruitment, an issue the military has been battling with in recent years. According to the 2020 Qualified Military Available Study shared with Military Times by a DoD spokesperson, when considering young potential recruits ineligible to join for one reason alone, the most prevalent disqualification was for being overweight, at 11%. At the end of September, a Senate panel is scheduled to discuss the high cost of weight loss drugs. Meanwhile, the House version of the annual defense policy bill that passed out of the chamber in the summer includes a provision that would require the Secretary of Defense to develop a strategy to align the obesity-related programs of the Department of Defense with the classification of obesity as a medically accepted disease. But the legislation still has a number of hoops to make it through, including the Senate and getting the president's signature before it becomes law. From Military Times, I'm Jonathan Lehrfeld.